Hi, my name is Emily Gatto. I'm 26 years old and I'm from Bluebell, Pennsylvania. I'm currently living in London, England, working to earn my master's degree in Middle Eastern archaeology. My mental health story really begins when I was in high school. I would often feel overwhelmed by periods of depression, but I never really thought it was a problem, and I really didn't want anyone to think that I was crazy or look down on me or judge me or something like that, so I never told my family or my friends about these feelings. I was pretty good at putting on a smile and pretending to be happy. Back then, I didn't realize how dangerous it could be to hide these sort of feelings, but eventually it caught up to me in the worst possible way. In 2005, I was starting my freshman year of college at Tulane University in New Orleans when Hurricane Katrina hit, forcing me to spend the fall semester at Syracuse University. During my time at Syracuse, I was really unhappy and began experiencing strong mood swings, which were particularly bad when I felt depressed. As I did in high school, though, I did my best to hide it and never told anyone around me. In January of 2006, I went back to New Orleans to continue my freshman year at Tulane. Things were better for the first few months, but unfortunately, I was in a pretty bad roommate situation, which triggered some psychological backlash for me. My psychological problems were compounded by the fact that I was also physically sick. I had several bouts of strep throat, and then I had mono. And by the end of the spring term, I decided I needed to see a psychiatrist or a psychologist at school because I could no longer deal with the depression that I was feeling, and it was really starting to affect my schoolwork, which was a big problem for me. Then I guess fast forward to the beginning of 2007, when the state of my psychological well-being was again sort of thrust into turmoil, and I began having really strong suicidal thoughts and urges. These thoughts persisted throughout the spring term, but I did my best to complete my schoolwork. I finished the semester and flew home at the first opportunity. By now, I was 20 years old. And before going home, I actually told my mom about these feelings that I was having suicidal thoughts. So she scheduled an appointment for me to meet with a psychologist within a few days of flying home. So when I went to the appointment, I told the doctor how I'd been feeling and having these suicidal thoughts and things like that. And she suggested that I try an outpatient program at a mental health facility because I was going to be home alone all day while my parents were at work. So we felt that it was best to have some sort of a structured program, people sort of watching out for me. Um, because also I realized that I didn't really trust myself to be unattended since I was feeling so suicidal. So I decided, okay, I'll give it a try, do this outpatient program. But when I called the facility to set it up, they told me that I had to commit myself to an inpatient program. That's just the way it worked there. And it was basically just to ensure my safety and give the doctors there a chance to evaluate my case. I felt really strongly that I didn't want to do an inpatient stay. I really didn't think I was that bad. When you're really depressed like that, you don't necessarily have the most rational of thoughts. But my parents sort of convinced me that I should just go and check it out and see what happens. Um, Once I got there, though, I felt like this was the biggest mistake I had ever made. My parents came with me. We signed in, and we were ushered into this locked room that had bars on the windows, and there were all kinds of patients, adults, children, teenagers. Everyone had different situations, different mental health problems, and no one told us what was going on. They basically just sent us all into this locked room with bars on the windows. There were no staff people in sight. No one knew what was happening. We waited for hours and hours and hours, not knowing what was going on. And I was so scared and I was confused. And I thought, this is the worst thing. How is this going to make me get better? And all I wanted to do was get as far away from there as possible and never go back. But that wasn't the case. I had to stay. And I realized it then, though, sitting in that room. And I still realize now that the way that they handled the admittance of patients was so flawed. I mean, really, I think they would be well served to reevaluate their procedures so as not to make mentally unstable people feel even worse, as was the case with me. Also, the lack of communication between staff and those of us waiting in the room was totally unacceptable. And in hindsight, though, it was only the first of many instances of poor communication that I experienced throughout my treatment and even beyond my stay at that facility. So then, during the summer of 2007, which was basically when this was going on, I had two more inpatient stays due to suicide attempts, but both of these were at psychiatric wards inside a hospital rather than a specific mental health clinic. And it was during the first of those two stays that the doctors realized that I was actually suffering from bipolar 2 disorder as opposed to just depression. So they started me on different medications, trying to balance out my mood. But it was really difficult to find the right combination. At the same time that all of this was unfolding, I was also diagnosed with thyroid cancer, which really complicated my treatment because I was taking a host of medications for different purposes, all being prescribed by different doctors. It caused serious problems because my mental health providers were not communicating with my primary care physician or with my endocrinologist. And at one point, I was prescribed a few medications that couldn't even be taken together, which should and could have easily been prevented had my doctors been talking to one another. But instead, I had to learn about it from the pharmacist when I went to pick up the prescriptions. So definitely, I think where it applies, communication between mental health providers and physical health providers, or primary care physicians, is crucial in terms of ensuring not only a successful treatment plan, but also in avoiding dangers that could harm the patient both physically and mentally. I mean, this could have been so easily prevented, and it's just a shame that no one was talking to one another. Um, Moving forward, though, when I was at my most depressed, it really felt impossible for me to imagine any kind of life where I could be happy or independent or successful. I really, truly could not just close my eyes and foresee a positive future for myself. So I felt totally trapped and beyond hopeless. Around this time, my parents, at the advice of a doctor, they took me to see a psychiatrist to undergo a battery of psychological tests to sort of evaluate my capacity for returning to school and or work. And after completing the exam, the psychiatrist, who had only ever met me once before, told me very bluntly that I would never be able to return to college full time, which meant that I would lose my academic scholarship, and also that I would never be able to hold a full-time job, which essentially meant that I would have to depend on other people to support me and to help take care of me for the rest of my life. At 20 years old, I thought this was crazy. I couldn't believe it. And it really triggered something in me that changed my life and my treatment. I knew that he was wrong, and I was determined to prove him wrong. So I went from being completely hopeless and therefore really not caring about getting better or realizing that I could take control of my treatment and my life and become a successful person. I changed though. I went from hopeless to realizing that I could do all those things. So I ended up going back to college full time, and for my first semester back, I got a GPA of 4.0, which just further motivated me to get better and take control of my life and my treatment. So now it's been nearly 6 years since my first hospitalization. I'm leading a very productive and successful life. Before, I was completely 100% dependent on my parents, but now I'm living alone in London, working on my master's degree. I have great friends. I'm in a wonderful, healthy relationship, and everything's great in my life right now. And so for me, being told that I could not do something and wanting to prove to everyone that I actually could do it was the turning point in my recovery and enabled me to turn my life around. For other people, however, this might not be the case. As such, I think it's important for healthcare providers to carefully consider the messages that they're giving to their patients. Of course, doctors should not give patients false hope and tell them, things that might never actually be possible. But rather than telling people what they can't do, maybe it would be better for them to focus on explaining strategies for overcoming challenges and expressing realistic but positive messages. I think positivity is crucial in dealing with people who are truly hopeless and a bit unstable because it can really make a difference in that patient's care. As I mentioned before, though, communication and the lack thereof was a major problem during my treatment. There was no communication between my doctors, and no one would speak to my parents either. My parents never asked any doctors to tell them what I was sharing with them. They never wanted to break my confidence, but they were seeking guidance just about ways in which they could keep me safe and prevent me from harming myself since I was living with them and they were taking care of me, 24/7. Citing privacy laws, however, my doctors all told my parents that they could not talk to them at all, despite my having given consent for them to do so. So this was especially frustrating for my parents because all they wanted to do, their only goal was to protect me, and they had no idea how best to do that. And it's a shame because if I had diabetes or some other physical condition, my doctors would not hesitate to explain to my family, signs or symptoms or what to look out for in terms of a problem that might be arising. But because it had a mental health condition, they were not allowed to give any information at all. I think this is completely detrimental to a patient's treatment because really, if someone is suicidal or otherwise unstable and relies on family or friends to help care for them, then those people should be informed about how to actually protect them. I mean, this is important, especially I would say for pediatric patients, because they're usually supported by and taken care of by their family and are living at home, especially if you're a teenager. So it's imperative that those family members are well informed. And I think it definitely should and can be possible for doctors to tell caretakers what to look out for or what to expect without breaking that doctor-patient confidentiality. And I just really think that this can be nothing but beneficial in treating someone with a mental health disorder. So, of course, I realize that each case is different, but at the end of the day, I believe that realistic positivity and open lines of communication are vital in assuring successful treatment of people suffering from mental health illnesses. For pediatric patients and young adults, perhaps a more family-centered approach would be better for parents, patients, and their families. This should seriously be considered by healthcare providers so that it's a win-win situation for everyone, and the patient is the focus, but everyone needs to help in assuring successful treatment. Luckily for me, my story has a happy ending despite these problems, but that same cannot be said for everyone. So why not just reevaluate the system in the hope of creating more stories of success and less unhappy endings? I really hope that my story and the stories of other patients can help healthcare providers to better understand some of the flaws in the current system so that they can be fixed for the benefit of future patients. Thank you.